Solve problems. Health assistants must use problem-solving skills to find solutions that are not always obvious. Problem-solving is the ability to analyze a situation and reach a reasonable conclusion. This skill requires looking at the big picture and combining factual knowledge with creative thinking. The problem-solving method may be used by health assistants to find solutions for problems. However, there are several items that health assistants must remember before implementing a plan. In a healthcare setting, problem-solving involves more than just one person. For example, a medical treatment problem involves the patient's family, and the healthcare team. Before acting on a problem, it may be necessary to consult with multiple people. When working with a team, compromise may be needed. If a team is working to find the best possible solution to a problem, compromise may be used to arrive at a solution that works for every team member. Health assistants must never perform tasks that are outside their scope of practice. If a solution requires a task that health assistants are not allowed to perform, they must consult their supervisor immediately.
The problem-solving method. Healthcare workers should use the problem-solving method on a daily basis. This method can be used by an individual or in group discussions. The problem-solving method is made of the following 6 steps. Identify the problem. What is the basis of the problem? What is causing the problem? Identify the objective that must be achieved. What is the goal? What must be accomplished? What is the big picture? Identify the circumstances that affect the problem. What are the facts? What is preventing the goal or task from being accomplished? Name all possible solutions. How might the problem be eliminated? How might the goal be adapted? Make and implement a plan. Which solution will be the most effective? Is the solution reasonable? Evaluate the results. Did the solution solve the problem? Would another plan have worked better? Should the solution be repeated or changed? Repeat the problem-solving method until the objective is achieved. Problem-solving example. Janine is a medical assistant. At 1:50 p.m., she is asked to transfer Mr. Vidal from his bed to a wheelchair. Then she must take Mr. Vidal to the 4th floor for therapy at 2 p.m. When Janine prepares Mr. Vidal for the transfer, she notices that the footrest on the wheelchair is broken. Janine can use the problem-solving method to find a solution to this problem. Identify the problem. The footrest on Mr. Vidal's wheelchair is broken. Identify the objective that must be achieved. Mr. Vidal must be transported safely to the 4th floor for therapy. Identify the circumstances that affect the problem. Mr. Vidal cannot be transported in a wheelchair with a broken footrest. Doing so might cause an injury. Name all possible solutions. Leave Mr. Vidal in bed and skip therapy for today. Transport Mr. Vidal in the broken wheelchair. Help Mr. Vidal walk to the 4th floor for therapy. Find a new wheelchair for Mr. Vidal. Make and implement a plan. The best solution is to find a new wheelchair for Mr. Vidal. It may take a few minutes to locate an available wheelchair, so Janine should call the therapy department and notify the therapist that Mr. Vidal may be a few minutes late. Problem-solving example. After Janine implements her plan, she must complete the last step of the problem-solving method. Evaluate the results. The plan was successful. Even though Mr. Vidal was a few minutes late for therapy, he was transported in a safe wheelchair.